So rheumatoid arthritis, you say there's a lot of hope for people and possible reversals with people with rheumatoid arthritis. Before you get into the answer and some of the protocols, let's talk a little bit about you, your background, your training. I know you're here from Connecticut and California. You're speaking at one of the largest functional medicine conferences, teaching medical doctors about fibromyalgia and how to reverse it. And you're a professor.
Yeah, I'm a professor at the University of Bridgeport and oversee their Division of Health Sciences. And I have a private practice in Connecticut, Whole Body Medicine in Fairfield. And I was out here in San Diego speaking at the Institute for Functional Medicine, one of the largest conferences in the world in more integrative and functional approaches to chronic disease.
Okay, now this is where medical doctors get together and what, share ideas, even from Europe?
From all over the world. It's an international conference. We have physicians from all over the world, and we have some of the best and brightest coming to share what they're doing in their practice, not only clinicians, but also researchers.
Is this your first time lecturing to this group?
No, I've been lecturing to this group for many times over the last 10 years or so.
Okay, so let's talk about rheumatoid arthritis.
Right.
Kind of a basic dummied down version of what it is, and I guess you're, especially in the functional medicine group, you're seeing some reversals.
Sure. Rheumatoid arthritis is basically, fundamentally, when the immune system is starting to attack your own joints. So it can no longer tell the difference between you and something that it should attack. So right now, the medical management has all basically been about reducing inflammation, reducing the immune response. And now there's very strong drugs that do that. They're called response modifiers or biologics, and they can be very effective at controlling symptoms because they just reduce the fire, okay?
Pain, so the person feels less pain.
Yes, but it doesn't stop the disease process itself. And they have very, very significant side effects in some people. So we're always looking for other options, either to use in combination or in some cases instead. And in rheumatoid arthritis and in all autoimmune disorders, we're looking at what are the triggers that actually start making the immune system no longer be able to tell you from something that's not you, something it should attack from something it should not attack. And we're looking into chronic viruses triggering this immune response against tissues. We're looking into, in particular, bacteria that are overgrowing in the intestinal tract. The hottest level of research right now in medicine probably is in what's called the microbiota. It's the bugs that live, or the microbiome, some people refer to it. It's the bugs, the bacteria, the viruses, the protozoa, the fungi that live on us, in us, and around us. And there's nowhere where there's a greater diversity of that than in the gut, in the tube that runs through the middle of us. And if that's not right, it can actually trigger immune responses to control that infection that can confuse the immune system and have it attack your own joints. So we're going down to the source of where the dominoes start to fall. And we try to correct.
And are you seeing results? Are you seeing people that had...
Absolutely. You can't undo damage done. So if you have someone who's had rheumatoid arthritis for 30 or 40 years and they have joint, derangement and things like that, you're not going to correct that. But what you're doing is you're slowing down.
You could stop the progression?
You can stop progression. You can at least slow progression by just reducing the amount that the immune system is being amplified into this hyper-aggressive stance. We also look at foods, though. There are many food proteins that can create this phenomena, which we call molecular mimicry, by the way. A protein in a food looks enough like a protein on your own tissue. So if it's in the joints, if it's in the linings of the joints called the synovium, then you direct the immune response against the joints, and it's rheumatoid arthritis or ankylosing spondylitis or another inflammatory arthritis. There are specific bacteria, for instance, we know can create this cross-triggering, this molecular mimicry in rheumatoid arthritis. And we look for them, and if they're there, we eradicate them, and we reconstitute better gut
With supplements,
health.
with medications, with both?
We can do it with both. We try to do it with herbs, botanicals, volatile oils, probiotics, different things that nudge the gastrointestinal environment in different ways. Sometimes it's to kill bacteria, sometimes it's to bring up the levels of the good ones that we want to be there to crowd them out. Sometimes we do have to resort to prescriptive antibiotics, but it's actually quite rare.
Okay, now this is not for television. We have different rules on the internet. This is on our website. So I'll put you on the spot here. Have you ever seen reversals where somebody said, I had rheumatoid arthritis, I had all the symptoms, it's gone? Have you or colleagues ever heard of these complete reversals?
Well, what we see is disease stasis. That means that they no longer progress. They don't get any worse. And in some cases, in many cases actually, they feel totally normal.
So
their antibodies
so
come
you've
down.
had people like they had problems with their hands,
Absolutely,
things like
yeah.
that, and no longer have problem with their hands.
Yes, but we're not only doing the things I just said, we're also cleaning up their diet. We're getting them off foods
well,
that
that's what
trigger
I'm getting
it.
at. I mean, it's not just one simple
Right.
thing, but the point is that people that had these problems, diagnosed with rheumatoid arthritis, you've seen where they say, I don't have it anymore.
Absolutely.
Really?
All the time. Now, it depends how severe they are when they come, right? The further the train is down the track.
So if you catch somebody in their, my mother had it in her 20s, right?
Right.
But let's say you catch somebody in their 30s, it's just starting. They
That's
just
when
got
we
a
want to
diagnose.
catch it. That's
And you
when we want to catch it. When we catch it there, then we're very, very
You
successful.
could be bold on this show, okay? Here we go. We don't want to be politically correct here.
Right.
Are you convinced if somebody follows your advice, the lifestyle, the this and that you could pretty much slow or stop that arthritis in its tracks?
Yes, particularly the younger we catch it in the
Good.
earliest stage, the more successful it is. In fact, Randy, we now have testing, predictive autoantibody testing. We can tell not only if you have rheumatoid arthritis and many other autoimmune diseases or not, we can tell if you're going to get one in 5, 7, 10,
Really?
or 15 years. So if you have a family history, like you said, your mother,
Yeah, yes.
I don't know if
My
you want
mother,
to-
it was my mother. No,
Okay.
go ahead.
All right. You said that you have a parent that had rheumatoid arthritis. If that's the case, I want to test your autoantibodies for rheumatoid arthritis, and I want to find out if you're a candidate to get it later. And if you are, I want to put these things into effect now.
But
That's
in your
true
book, by the way,
preventive
even
medicine.
like your Fibro Fix book,
Yes.
that 21 day of eating would be the same kind of thing?
That would be
I
a
would wanna
similar
do?
common thing that you would do to just sort of become less inflammatory, to become less immunoreactive, to be healthier, to have a better, robust metabolism. But there are definitely specific things we want to look for and do which relate to the disorder that we're concerned you developing based on your family history. If it's rheumatoid arthritis, we know the kind of bugs to hunt down. We know the kind of foods to avoid.
Do you think so? It is caused by a bug?
It can be. There's
What's your
multiple
opinion?
pathways. It is very commonly caused by a stealth infection. There are bacteria known as, for instance, Klebsiella, Citrobacter, Proteus, that are known triggers to cause an immune response against the joints that could end up in a disorder that will be diagnosed as rheumatoid arthritis.
What flames the fire of rheumatoid arthritis? Would sugary foods, lots of gluten?
Gluten is certainly one.
I mean, what's going to
Dairy
really...
is another, but it's really unique to that individual. So we do testing that looks at an individual's immune response, their inflammatory, or what we call the inflammasome, activating based on various foods. So we'll check 200 foods and see how your immune system gets along with them or not. And we take out not only the big ticket items, yeah, gluten is low-hanging fruit, so is dairy, but there may be other foods that are perfectly healthy in general for the average person, but if your immune system doesn't like them, we have to pull them out so that you don't create these issues in your immune response that can end up getting you where your mother got.